everyone, I'm Dr. Sharon Rasquinha, an obstetrician and gynaecologist, your woman's doc, Mangalore. Pregnancy is definitely a beautiful and a memorable journey in every woman's life. As exciting as it gets, it also brings in a lot of anxiety and nervousness. We have a lot of people around us to give us unlimited advice on what to eat and what not to eat. So today I'm here to bust out few myths on the diet during pregnancy and also what you got to eat during pregnancy. First I'll talk about the facts. The first one is eat healthy, home cooked, balanced diet. When I say balanced, which includes good amount of carbohydrates, proteins, fats, vitamins and minerals. For carbohydrate, you can eat rice, dosa, chapatis. And for proteins and non-vegetarians, it's like egg, fish, meat. And for vegetarians, we have dal or pulses or paneer, tofu, milk, curds. These are all rich, good source of proteins. Also have 3 to 4 servings of fruits and vegetables. Good amount of like green leafy vegetables because it contains a lot of good iron content and you need good amount of iron because to prevent anemia in pregnancy. You got to have different type of colorful fruits and vegetables because every fruit and different type of vegetables contain a lot of different minerals and vitamins which are definitely essential during pregnancy. Eat small frequent meals, like do not eat one particular meal which is very heavy and definitely that causes a lot of gastritis or feeling of nausea. So you can divide and eat small frequent meals so that you can feel better and you will have a continuous supply of good nutrition also to your baby. Avoid junk food, oily food and spicy food definitely during pregnancy because again like I said it causes a lot of gastritis and especially in the later half of the day because you'll end up having something called as GERD, which is gastroesophageal reflux, which is again commonly seen during pregnancy. Second thing is drink lots and lots of water because water is necessary to keep yourself hydrated. Water is also essential for your good bowel movements, which is again which is very commonly seen during pregnancy, a lot of constipation. And water is also essential because there are a lot of urinary tract infections which are very again commonly seen during pregnancy. So water also helps to keep yourself hydrated. So have lots and lots of water, around at least 2 to 3 liters of water. Next, avoid uncooked food like fish or meat, like you have those sushis, which uncooked fish or cold cuts because it contains something called as salmonella and this salmonella infection is not very good. It's not good during pregnancy. Even packeted food or frozen foods contain high amount of sodium and preservatives which are again not good during pregnancy. Like have pasteurized milk, even cook your eggs well and not eat raw eggs, which is again not recommended. So this is another third thing that I want to tell. Next, fourth thing is to no smoking and drinking during pregnancy. Even wines contain around 5 to 11% of alcohol, so which is again harmful. There is no recommended dose or safe limit of alcohol that is recommended during pregnancy. So when you have alcohol, it directly goes into the baby and it damages your baby's brain cells. It causes a lot of deformities, facial deformities, mental retardation and learning disabilities later in childhood. Even smoking contains a lot of gases like carbon monoxide or carbon dioxide. These gases, when inhaled by the baby, causes a lot of miscarriages or growth restricted babies, preterm babies or premature rupture of membranes. So therefore, in pregnancy, smoking and alcohol is definitely a no. Now I'm here to clear or bust out certain myths of a diet in pregnancy. The first one being eating for 2. Definitely no. Do not overeat and eat double the amount because it's not good. You just require that extra 300 calories or kilocalories per day. But if you're doing like strenuous work or heavy work, then okay. Then you require just a 50 or 100 kilocalories. Now if you eat extra and if you eat a lot, then you end up putting on a lot of weight and you're very well aware that shedding out that extra kilos later, it's going to be very difficult. Apart from that, if you put on or gain a lot of weight, you know that there is something called as gestational diabetes. You become diabetic in pregnancy, which again is very harmful. or not very good in pregnancy. So your weight gain all depends upon how your pre-pregnancy weight. Like if you were, if your BMI was ideal, like if you're not overweight, then yes, you can put around 10 to 12 kgs of weight. But if you were overweight or obese, then definitely you cannot afford to put on around that much of weight. Second one is that eating papaya, pineapple or sesame, that is til or citrus fruit, causes miscarriage. No. Yes, raw papaya contains something called as papain, which is a uterine stimulant or which causes contractions. So that can be avoided, but fully ripe papaya and pineapples is definitely good in lot of nutrients, vitamin A. So definitely it is very good and healthy for your baby. There's nothing, it doesn't cause any miscarriage. So you can definitely have them. Third one, drinking coconut water is definitely harmful, and the patient or the mother will catch cold or the baby will catch cold and etc. There's nothing like it. Coconut water is very good. It contains a lot of minerals. We definitely recommend all the pregnant women to have whenever it's possible, because it's good. It keeps you hydrated and definitely do not cause any harm to you or the baby. Next, fourth one, that is certain herbs or saffron, will make your baby fairer when they are born. So that's definitely a no. There's nothing that can determine your baby's color or your intelligence. It's all genetically predetermined. So whatever you eat or drink doesn't definitely affect the color or the intelligence of your baby. Next, if you drink, fifth one and the last one, if you have a lot of coffee and tea, again your baby will look darker. So yes, coffee and tea in excessive amount is not recommended during pregnancy. You can have 1 or 2 cups during pregnancy, because caffeine is definitely a cerebral stimulant. It's not good, and it causes a lot of indigestion and gastritis. Therefore, we do not recommend an excessive amount. 1 or 2 cups, like you have one in the morning and the evening, it's okay. But again, these caffeine or the tannins that are there in tea definitely do not affect your baby's color. Everything is genetically predisposed. So thank you.